Gracias. Thanks very much for having me. I'm going to try to share my screen. Javier or someone, can you, is everyone seeing my screen? Can someone let me know if this is working? See it. ¿Funciona o no funciona? All right, I'm not hearing anything. I'm assuming though that this is, you are all seeing my screen? And I cannot hear anyone. Okay, it is working well? Great. All right, thank you so much. It often does not work. Well, it is such a pleasure to be here. I'm sorry I'm not speaking to you in Spanish. I can understand it very well, but I am a little out of practice. To Javier and to the organizers, a message. I know we are behind in our schedule, and I will probably take less time than was planned for me. So I hope I can help us catch up a little bit. I think the theme of this conference is such a fantastic and important theme. The idea that we must look at good care and at problematic care, that we have to look at the possibility of maltreatment and also how to maintain a positive image of what is going on in the care of old people. It is so important to hold both ideas at the same time. So I am going to be talking more about the negative side, the problems that occur when there is direct violence or aggression towards older people, towards these very vulnerable individuals. But I also want to make sure that we understand that in the context of that we are also not just trying to end negative care, but also trying to develop good care. So that is why I'm so excited about this conference. I wish I could be with you in person. And I'm so, I also want to, I am actually hearing an echo, but I don't know if that's just me, but I'll just forge ahead. On the one hand, we must promote good care, developing new and positive processes and promoting good care for older people. And at the same time, eliminate or reduce processes and environments that lead to bad caregiving. I am going to focus more on the bottom part of this slide, but I think we can keep it in context. I want to talk today about a problem that often hides in the shadows, that often is one that we do not talk about and do not think about. But it is critically important in nursing homes, in other residences for older people. And I'm going to say that we need nationally, globally, and locally to try to eliminate violence in nursing homes. That everything else we do, also, when I say nursing homes, I mean residential environments for older people. I know in different countries, these have different names, and they are configured differently. But so you know, I think I'm talking about group residences for older people. Violence in long-term care is easy to ignore, but now is the time that we have to confront it on the level of local residences and facilities and on the societal level. I think that we actually need a global campaign to eliminate violence in long-term care residences. Nursing homes, residences for older people, are often places that are staffed by kind and caring individuals who are providing the best care possible. But it is a surprising fact that nursing homes are also very violent places. verbal and physical aggression are daily experiences for staff and residents. So if you talk to anyone who works in a unit, in a residence for older people, especially one where people have problems with their memories, they have Alzheimer's or dementia, you will know that verbal aggression and violence, physical aggression, are daily experiences for residents and staff. So if I think of my job as a college professor, I very rarely even have an argument with someone else. Staff in residences for older people encounter the possibility of themselves having a violent act or of residents being violent towards one another. Now, there's been much attention to this because in the media, at least in the United States, in the United Kingdom, and elsewhere, there have been very highly publicized cases. Here is an example, and this is from England, where an 80-year-old woman was assaulted by her caregiver at a nursing home, and she thought she was going to die, and she tried to fight back. She had bruising on her face and neck and head, a cut on the back of her head, and bleeding in the brain. There also have been very highly publicized media reports of resident-to-resident violence. So in the United States, a 98-year-old woman killed, she murdered her roommate. Both of them had Alzheimer's disease and they were not responsible, but there was an actual homicide prosecution in this case. So one question I want to talk to you about, we now have studies over the last 20 or so years answering the question, how big a problem is violence in nursing homes? So I will tell you first the depressing or difficult part, and then I will tell you where the hopeful and good parts are. So there are three kinds of violence that can occur in nursing homes: staff to resident violence, resident to staff violence, and most important from our work, resident to resident violence. There's problems with the research. There are very few studies, and only a few studies are good. We heard in the first presentation about the importance of evidence-based medicine and evidence-based practice. Well, we need more evidence, but rates from those studies we have also probably underestimate the problem. It's very hard to observe violence in nursing homes. Most elder residences do not keep good records. And also, if you talk to people, they sometimes do not admit violence or abuse they have seen. However, here are some findings from studies. One study asked staff members in residences for older people, what have you seen staff do to residents? So our first topic is violence or aggression towards residents from staff, from nurses or nursing assistants. At least 1/2 of staff members had seen another staff member swear at or insult a resident in the past month. At least 1/4 of the staff had seen a staff member actually push or shove a resident. And 1 in 10 staff saw another staff person slap or hit a resident in the past month. So that is a fairly common occurrence. Even though staff feel badly about it and regret it, we do know that violence from staff to residents occurs. Much more frequently, and any of you who are listening who work in residences for older people know how common it is for staff to be assaulted by residents. So residents with a sad frequency will hit staff, they will pull their hair, scratch them, bite them when they're trying to provide care. And this is not their fault, it is because they have, brain disease. But we found in one study, in just a 2-week period, almost 8% of residents in older people's residences had been violent towards staff, and 12% had been verbally aggressive. They had insulted them or used racial insults. So overall, 15%, close to 16% of residents in residences for older people had been aggressive towards staff in just a 2-week period. So staff confront this problem on a daily basis, and it is very stressful for them. One thing that we did find in our studies, residents who were more likely to be violent towards staff during morning care, in their own room, and people who needed a lot of assistance were more likely to be violent. But the biggest problem we have found is not staff being violent towards residents or residents being violent towards staff. There is a hidden problem that people do not talk about much or think about much, but that is quite common, and that is resident-on-resident violence and aggression, especially in units or in residences where there is a large concentration of people with dementia. My colleagues and I have done the most extensive research on this, and we have conducted a study in 10 nursing homes in the New York City area, in which we assessed over 2,000 residents, and we used very extensive research to uncover all of the resident-to-resident violence. And when I say resident-to-resident aggression, again, those of you who work in residences for older people will know this and have seen it. 2 older people are sitting next to each other in a dining room, and one hits or shoves the other person. 2 people are walking close to one another in a hallway, and one will shove the other resident. A resident will wander into another resident's room, and that resident will shove them out the door. So this happens very frequently, but we did not know how frequently. We found that of the total prevalence in just 1 month, fully 20% of residents had been involved in an aggressive incident with another resident in just a month. If we translated that figure, and about 6% had had a violent event with another resident. So as many as 6 in 100 residents had this happen. So that would mean in the United States that around 74,000 United States nursing home residents in a given month experience a violent altercation. That is a lot of people. That is many, many people, and it's a big problem. Verbal aggression occurred in around 16% of residents in just a month, and a sexual event of someone engaging in sexual aggression occurred in 1% of nursing home residents. We learned some things about who is likely to be involved in an event. It is not your sickest and most frail residents. It is people who are moving around, who are more ambulatory, who have dementia, who have roommates. They are able to go around and to get into one another's way. So we found it is younger and more ambulatory residents. Also residents in nursing homes with smaller staff numbers, where there is a shortage of staff, there is more RM. There is more of this resident-to-resident elder mistreatment. All of these types of aggression and violence in nursing homes lead to injuries. Because the residents are so frail and so impaired, even minor incidents can be very harmful, like if someone is pushed. But there is a lot of problems caused by residents seeing this happen. So if you're a resident who is not involved, but you see 2 people being violent towards one another, it affects your psychological well-being. It's very likely that being in these aggressive incidents leads to higher mortality, and it certainly has negative effects on staff. In surveys we have done, staff tell us they do not know how to handle these incidents, they feel powerless, and they do not know how to respond. So in the remainder of my time, I want to move to the positive side. What do we do to make a change? What can we do in nursing homes? How can we turn, the negative treatment into good treatment? And I will talk a little bit about that, and then we'll have time for questions. So there are three reasons. Why doesn't this problem change? Every one of you who is listening is, I am sure, nodding your head and saying, yes, we see violence and aggression, especially among residents. We see it frequently. It's a very common experience. It's a daily occurrence in nursing homes. Why don't we change it? So one is that this problem is unfortunately widely accepted. Second is we don't have enough information about it, so we are ignorant, and those two things lead to inaction. We have learned now in many studies, and other researchers have found the same thing, that violence and aggression in nursing homes, people stop seeing it. It becomes a routine feature of nursing home life. It is ubiquitous. It is ever present. So staff routinely overlook at it. And let me give you one example. In our studies of resident-to-resident violence and aggression in residences for older people, we uncovered many, many events and incidents, as you saw in the data I showed. Almost none of these incidents were ever documented on a patient record. Almost none were reported to anyone. Staff just saw it as part of what happens in residences for older people. Now, I want to give you one example. I think in Spanish, you use the term bullying. So you've adopted the English expression. Here is an example. When I was a child going to school close to 50 years ago or more, no one talked about bullying. It was considered to be normal. Children just did this kind of thing. I would never have told my mother or father that I was being bullied. I would never tell a teacher. It just was assumed to be a normal feature of life in schools. And we children were encouraged to work it out among ourselves. In the last 10 years, this attitude has changed very dramatically. In the United States, we have programs against bullying. Schools are no bullying zones. People are taking pledges to end bullying. Children wear t-shirts. Broadway, our theaters in New York, are helping with an anti-bullying campaign. Our government has Stop Bullying website. So in just a decade, people have decided that a behavior that everyone accepted is no longer acceptable. I will say too, there is work, I know there is work in Spain, and there's a whole approach towards people of Hispanic, descent in the US, this Plan de Acción contra el Bullying. Now, we can do this same change in attitudes in nursing homes. We need, I believe, an approach that says we have a zero tolerance for violence in nursing homes. So we can no longer accept it as something that occurs normally or naturally, and we throw up our hands, as we say in English, and we cannot do anything about it. So that is the problem with acceptance. Our problem with ignorance is that we do not have enough research. Again, we want evidence-based interventions, but there's been very little research, and it is methodologically weak. So our ignorance is the fault of people like me, us academics. But we need to study violence in nursing homes and understand how to prevent it. So as I say, we need governmental funding of research. So if there are any policymakers listening, I encourage you to think about creating funding for research in this area. And we need a very strong research agenda to understand why nursing homes have so much violence and aggression. So if you take acceptance, oh, there is nothing we can do about this problem, that attitude, and our lack of research knowledge, you get to inaction. So I want to say one last word about what residences for older people can do and what policymakers can do, and then I will stop. Improving training is one of the most important things that we can do. Even though nursing homes are filled, they have much violence and aggression, we very rarely train staff specifically in violence prevention. So staff need to know, what do I do when two residents are fighting? How do I separate them without hurting them? What do I do if a resident grabs my hair and starts to pull it? How do I get out of that situation without hurting the resident? What are some trigger points? What can I do? You know, how can I learn when maybe I shouldn't come close to a resident or shouldn't place a hand on him or her? These are highly specific, and I know they will sound very specific, but in mental hospitals, in other locations where there is violence, people are trained. And we do not usually do that in residences for older people. We need to encourage staff to identify these cases. If they see two residents hitting one another, not just to let alone, but to think about the resident's care plan and bring in, a treatment. So plans of care need to address violence. And low staffing in residences for older people means more resident-to-resident aggression and violence. And finally, policymakers, both at the governmental level and in large-scale not-for-profits, NGOs, the one thing you can do, policymakers, is change this norm of acceptance. And we think that the World Health Organization should do this, and other major national and international groups, to change this norm that, because you have a concentration of people with dementia, there is always going to be violence and aggression towards residents. So I think that we need a campaign specifically focused on ending violence in nursing homes. We must strengthen data collection on extent and causes, that we have to understand what factors lead to higher rates of aggression and violence and how do we stop it. And we need to evaluate programs, again, coming back to the very good comments at the very beginning. What evidence-based programs can we create that will make aggression and violence in nursing homes lower? I think on the national level, in the United States, so we would like people to do this and elsewhere, is to have a comprehensive and a data-driven national plan. Those plans exist for child mistreatment. They exist for violence against women. So a national plan for ending violence in nursing homes. We also need to enforce existing laws. There are times when the police or law enforcement could and should be involved, and other legal remedies. So I think of what we need to do at local levels, regional levels, and nationally is say, we will have no more tolerance for having such high rates of violence and aggression in institutions, in residences that serve our most vulnerable population. Here's what we're going to do to reduce it. Here are the targets, and then we'll track our progress. And finally, the way forward means working together. And what do I mean by that? One is that researchers and practitioners, social workers, nursing home staff, directors of residences, policymakers in government, all of us must work together to reduce the amount of violence, abuse, and aggression in residences for older people. We should stop blaming other people, that we all should work together. And internationally, we should exchange ideas. And that is why a conference like this is such a wonderful opportunity for people to come together and talk about the road ahead. What can each of us learn from one another? In one of the countries you are from, you may have found solutions or ideas that we in the United States could benefit from, or Spain could benefit from, and vice versa. So all of us need to work together to share our ideas. And let me stop there. Now, I may need, have I stopped? Yes, it looks like I have stopped sharing. Is that right? Now, so I give it back to you. I'm not hearing anything right now. I don't know. Oh. So I can. Oh, am I still? I'm not sure if I am still sharing. No.
For your presentation.
There we are. There we are.
The participants have some questions, but the question more frequent is what is the impact of COVID-19 pandemic over the good care or over elder abuse?
Excellent question. And I'm sure you will be looking at. So let me ask, I am hearing an echo, but perhaps no one else is? Oh, good. It is good now. Thank you. This is such an important question. So one of the most important issues in all of this is, did COVID-19 start something new? Did it create new problems? Or did it primarily accent the kind of problems we are already having? So did it simply show us the enormous weaknesses in our system that already existed? And I think that the answer is yes to both. I think Spain is a little different from the United States, but one of the key problems that we have in nursing homes is the following. We have chosen to take the most impaired and sick and vulnerable people in our society, and the people who are primarily caring for them are individuals who are good and kind people, but who have very little training, who are not trained very extensively, and who deal with extraordinarily difficult situations. So we learned in the pandemic that the way we staff and train people who work in nursing homes is simply not adequate. We almost invariably have too few staff, and we almost invariably do not train them enough. So I think that is one problem. Here's a second issue that we've learned, but it will be very difficult for us to do some things about. I think that we've learned how the physical environment in nursing homes contributes to the problems of the pandemic. For example, having individuals share small rooms, having 2 or 4 residents in a room, is not viable really for the future. It's not good for residents anyway. Having small cramped spaces, not having outdoor areas, those are all problems that COVID-19 has shown us. Third, and I will stop here, this was a system that was simply, in the United States at least, not prepared. It was extraordinarily difficult to get protective equipment to nursing homes. Even things like gloves or gowns or masks weren't available. So we have to be much, much better prepared, because pandemics are going to hit nursing homes first. So I think, I hope that the impact of the pandemic is to highlight the weaknesses and that we have the strength. I'm sorry, I will say one last thing. In the United States, people are going to stay home longer. They are going to do everything they can, I think, not to enter residences for older people now. There's going to be a massive demand for home care, and for the ability to stay home longer. Sorry, that was a long answer, but it was a very good question.
Yeah. And the answer is very good. And I have another question. Violence in nursing homes is kind of a taboo issue. It is difficult for institutions to assume it is part of their daily routines. How can staff be trained to prevent when there is not such acceptance in the first term?
It's a great question. So one thing, if people have my email address or anyone can contact me, we are developing, and if I had more time, I could have shown you, we have developed a program called Improving Resident Relationships in Nursing Homes or in residences. So we have created an evidence-based program for which there is a manual where staff are trained in a short time to recognize violent incidents and to report them and then how to deal with them. So there is one program that we can share. It is not yet in a Spanish translation, but for people who would like to see that program in English, that is something that we can offer. So one of the most important weapons that we have, the most important thing that we can do is to train staff in how to work with residents who are experiencing violence or who are being violent. The other key thing, if there is one thing that really works, but it is time consuming, and I'm sure you will talk about this later in the conference, so I will only say one word: person-centered care. Personalized care is one of the main cures for violence and aggression from residents. When we focus on the resident and create a specific care plan, then we can reduce some of the aggression. The idea is to look for the need behind the behavior. If someone is being aggressive, they are often either in pain, they are hungry, they are thirsty, they are bored, they have medication problems. The best way to deal with these is through training of staff and through understanding unmet resident needs that lead to violence and aggression. If we do that, I think we can reduce these rates to a very low number, but it takes those two things. Great question, thank you.
Thank you so much, Karl. Thank you so much for all.